Welcome everybody to the session about qualitative studies, and I'm a qualitative healthcare researcher, and I'm presenting this session on behalf of our RSS qualitative researchers team. And this session is focused on how to write the technical section of your application if you are including qualitative research. And by no means it is intended as a training session on qualitative research. It is much more about writing for the application. And in a moment, I will ask you to complete a poll so that we can find out about the level of expertise in the room related to qualitative research. But just in case we've got people very new to qualitative research, I will tell you a little bit about what qualitative research is and when we involve qualitative researchers in healthcare research. And also, we are going to provide you with some feedback from our funders and what the research that is including qualitative research is sometimes criticized for. So we are hoping that this is going to be very useful for you and lessons learned. And we are going to provide you with some tips on writing qualitative applications or qualitative part of your application. So what is qualitative research? Well, qualitative research, the term, is a very, very broad term encompassing a range of approaches and methodologies and methods. And it is mostly concerned with meanings people attach to their experience of the social world. In our case, we are looking at healthcare and how people experience that type of social world and how people make sense of what is happening to them and what they do in very different types of situations. So in our context, in the context of healthcare research, we use qualitative research to understand patterns of health behaviors, to describe lived experience, for example, how people understand illness and their experience of that illness, but also care that they receive, develop behavioral theories, explore healthcare needs, and design interventions, healthcare interventions. So, as an example, when exploring about patient experiences of taking medication, quantitative research and quantitative type of questions may seek to answer questions: how many doses were taken of particular medication, what percentage was missed, whereas qualitative question may seek to answer questions, for example, why are patients not taking their medication? What problems are they experiencing? What are their views and beliefs about the treatments, and whether they experience any particular barriers in participating in trials, for example. So these are the type of questions that we ask. So sometimes the question is being asked, is qualitative or quantitative better? Well, it's not really a good question. There is a space and place for both qualitative and quantitative. And not every question, not every research question can be answered in a by using quantitative approach. And the same applies for the other way around. So not all questions can be answered with using qualitative approaches. So it all depends. So when do we use quantitative versus qualitative? Well, it depends really on the questions we are asking. Qualitative tends to ask questions about how, why, and what, so it's much more exploratory. Then it's trying to develop hypotheses and a theory, so then the quantitative comes in to test those hypotheses and apply their theories. So it's much more exploratory, it's very granular, it's trying to understand the context, to interpret, to understand. And the type of data that we are using, it's narrative, it's words, it's objects, observations, pictures. So mostly symbols and language. So let's look at the examples of qualitative research and the questions that can be asked. So the questions we are asking are what, how, and why. And you may have questions about patient voice and experience. For example, why do young people not adhere to their asthma medication? You may have questions about some social processes that are being involved in healthcare and delivery of care. For example, how do doctors communicate prognosis to people at the end of life? You may decide to use qualitative research to explore a new area. It may be better to use qualitative research to do that, or a sensitive topic. Not all topics can be ethically researched. For example, by using questionnaires, you want to acknowledge that someone went through a traumatic experience, and qualitative research may fit that purpose better. You may want to consider using qualitative research to improve your study, for example, your trial. So you may do a feasibility study. You may do a study to optimize study processes, recruitment, and implementation. For example, what factors affect patients' decision to participate in a trial. Or you can do a different type of feasibility study when you actually look at feasibility of the intervention. What do clinicians think about the intervention components? How do patients engage with the intervention? So how to use qualitative research? It can be used on its own. So there can be very good studies that explore understanding and take our understanding of something further, or for example, of particular condition and how people experience it, and it can lead to how care is delivered, whether there are any improvements in delivery of care. But very often, and we see it very often in our service when we provide advice, there is a need to have a mix method studies, so where qualitative and quantitative are somehow brought together. So you may have a qualitative research phase when you explore and try to understand and collect narratives from your participants, to then develop a quantitative study that is of much bigger reach, for example. Or you may go the other way around. So you can first start with a quantitative research, but then you realize that there have been some issues that would require a bit more further looking, more in-depth looking, and this is where qualitative research can help you as well. Or you can triangulate data and do it almost simultaneously with a collection of qualitative and quantitative data that is trying to answer similar questions. So now I would like you to watch a short presentation. This is a report of a qualitative study. It is available online on YouTube. I guess I will wait to hear a qualitative study on communicating blood test results in primary care. Thank you very much. So now we are going to talk about the formulating of a research question. And first, you will see that it's very, very similar to any other research question that you would formulate, but the questions, the terms that we use, what, how, why, are more popular with qualitative research. We need to identify participant group, and then this is the tricky part. We need to start using the qualitative wording. So what are the views, experiences, perspectives, opinions of something? So this we are starting thinking in qualitative terms. And then we have to specify our topic of interest and identify broad topic of interest. I would like to go now through some pitfalls that were identified in the feedback provided in the chair's report from 2020. So this was aggregated feedback after reviewing many applications for that particular call, clinical lectureship and senior clinical lectureship. And it was recognized that while qualitative research has been acknowledged and researchers included it in their proposals, and it was actually warranted, so there was clear justification why there was benefit of including qualitative research. Actually, across the studies, it was qualitative aspects of the bigger studies, they were poorly developed, and also they were less developed than and lack the same high standard as those aspects of the study that were quantitative. So that's something worth bearing in mind. So what are the common issues that are being identified by funders? And the quotes I showed you were from 2020, but we still see the same issues in the applications coming through, and we are aware that the same type of feedback could be provided by funders now. So you will see that many of that feedback and the common issues is really across the both quantitative and qualitative studies. Every study has to be well justified and inadequate. So for common issue would be poorly justified and inadequate. But what happens later, if you look at the methods, data collection, often in qualitative studies, we see not enough detail. So someone who is, for example, developing a trial can very, very well justify and describe the trial itself, but the qualitative part of the trial, the qualitative study, is just few sentences that provide not enough detail. Why they are doing that study, what methods they are going to be using, what type of analysis they are going to be using. And often also we see that the timeline is unrealistic. So qualitative research takes time. It takes time to collect that data, and it takes time to analyze that data. And this is sometimes completely missed or not realistic. And we then know that someone actually don't have that qualitative expertise or don't have qualitative expertise on the team. And that's causing problems. Sometimes also we see that there is a confusion between qualitative research and quality of life. So sometimes people say we are going to be measuring qualitative of life, and they see it as they present it as a qualitative research while it's not. Or they say they are going to do a survey, but they don't explain exactly how qualitative research would be depicted in that survey. And there is sometimes confusion between PPI and qualitative research, and PPI sections are described as if they were qualitative research. So this is something definitely worth, and I'm sure you have heard about it as well during other sessions, but I will show you a slide that is trying to clarify that. And exactly that. So what's the problem here? Sometimes there's confusion whether what you want to do is qualitative research or PPI. And the easiest way of thinking about it is that if the people you are inviting to your study are your participants, are providing data that is going to be analyzed as part of your study, then this is qualitative research and should go into your study design. If this involvement of people is more to inform the study, so not to collect data from them, but to inform the study and design of the study, then it's PPI. Saying that, PPI will be informing the qualitative research, and I will show you as well how to marry the two. And now we are going to go into details, and I will show you an example of how to write the qualitative sections into your proposal. So the example we are going to be using is from HTA call, Physical Exercise for Depression in Adolescents. This was the project. The research question was, what is clinical and cost effectiveness of physical exercise for treatment of depression in adolescents? The intervention was high intensity physical activity or program of low intensity physical activity. So you see, it is a three-arm randomized controlled trial, but it's got a feasibility phase, and that feasibility phase is the qualitative research, and that research is used to specify and improve the interventions. and assess acceptability, uptake, and adherence by users to inform the full trial. So in the section on background, rationale, aims, and objectives, you have to specify why is this research important, or why this qualitative aspect of your bigger study is important. What are the gaps in the literature? What type of study do you intend to do? And clearly link aims and objectives to that. So I will read through that example. What is the aim? To explore patients' and clinicians' views and perspectives of the physical exercise intervention to inform a definitive trial. So we know it is a feasibility trial. What are the objectives? Use semi-structured interviews to explore acceptability of the interventions to patients, explore patient adherence to the intervention, and then also to explore clinician views on the intervention and delivery of the intervention, because we exactly want to know that how everybody who is involved in delivery of that intervention or reception of that intervention, what they think about that intervention. We don't want to miss views from anybody. So what about the study design? So it has to be, again, be coherent, informed by your question, aims, and objectives. Sometimes it will have theoretical underpinning, not always, especially in feasibility trial studies. It's less common to see that. But if it's a full qualitative research, then it's very likely to have that. Then you want to answer a question about how it fits other work planned in the application. So, for example, it informs the trial design and any other practical considerations. So, for example, you may say, this is a feasibility study with a nested qualitative component using semi-structured face-to-face interviews and thematic analysis. Next, in the study design, you would have a question about study population and recruitment. So you have to answer a question about who is your study population, eligibility criteria, go into detail. The committee really want to know how you are going to identify and recruit your participants so they are clear and reassured that you have thought through everything. So the example says, help-seeking adolescents with depression will be sampled from both intervention arms of the trial population. A letter, so we are looking now at how people are going to be identified, how participants are going to be identified. A letter, reply slip, and participant information sheet from the research team will be sent by post or email to the adolescents, inviting them to participate in a face-to-face semi-structured interview. Interested participants will return the reply slip to the research team, who will then arrange a mutually convenient interview time. So as you can see, there's quite a detail there, so that the committee, the founder, can know exactly that you have thought through the process and that you understand how to identify and recruit your participants. So in terms of sampling for your in your qualitative study, you have to answer a question, what sorts of participants are you looking for? And depending on that, you then decide what sampling strategy you can use. And sometimes it's not very often, it really depends on your research question and population you are approaching. The best way forward may be convenient sampling. So whoever is available, and especially if you are doing research around sensitive topics or with very small populations, this may be the best way forward, although it doesn't feel intuitive when you think about rigorous research. This is exactly what may be needed to be done. The most popular ones that we see is purposive sampling. So you may have maximum variation sampling when you are trying to maximize variation in your sample. So sample people of different ages, genders, with different level of particular condition, different level of experience of that condition. You may go for homogeneous sampling when you want to see how particular intervention works in very, very specific group of people. Or you may go for snowball sampling. That is quite similar to convenient sampling, but it's working in a bit different way. So people who you recruited then help you to recruit the next people. So you know that they know the people with similar characteristics. And then if you, for example, apply grounded theory, you will have to consider theoretical sampling. The most important is to understand the methodology you are using and stay within that methodology. So if you are using generic qualitative research, theoretical sampling may not be needed, but if you are using grounded theory, that theoretical sampling, when you decide about your sample as you go, who is the next person, what characteristics they need to have as you go and as you develop your theory, it will depend on your methodology. So for that example, we have purposive maximum variation sampling will be used to include participants with a range of ages, gender, comorbidities, and sociodemographics. Sample size. This is a tricky one because there are ongoing discussions about what is enough, how much is enough in qualitative research, and the best advice is really to stay with your methodology and follow advice that is given within your methodology. The good thing is that to realize is that in qualitative research, large numbers are not needed. We go for richness and depth of data and analysis. Again, depending on methodology you are using, different terminology and approaches can be used. Data saturation, for example, thematic saturation, theoretical saturation, depending which methodology you are using. Or you may go for information power, and it's especially in generic qualitative research, it is a popular approach. When you are rather looking at how rich data your participants can give you, and the more rich data they can give you, the smaller the sample can be. So the most important is stay within your methodology, but also justify your approach for sample size. What we see and what is acceptable in NIHR application is to have between 20 and 30 participants for individual interviews. And also, if you are doing focus groups, to have 3-5 focus groups, and they would include 5-8 participants per group. So, going back to our example, we will conduct 20-30 in-depth semi-structured interviews, which we consider will provide sufficient depth of data for analysis to answer our research question. Data collection, again, provide enough detail. How will your data be collected? Who will collect the data? When and where? And how will data be made available for analysis? So in the example, we've got semi-structured interviews will be conducted using an interview schedule to guide the interviews. The interview schedule was informed by existing literature and developed with input from our PPI group and clinicians. So you see, this is how PPI can inform your qualitative study, but it's very much separate. It is not qualitative study. It is how PPI informs qualitative study. The interviews will be held in the patient's GP surgery or virtually via Teams, according to patient preference, and will be approximately 45-60 minutes duration. The interviews will be digitally recorded and transcribed verbatim for analysis. So what type of data you can have? Well, again, it depends on your research question. And it's good to have that table handy when you are deciding what source of data you are going to need. You may have interviews, focus groups, diaries. You may have observation. You actually may use social media. You may have media articles. Yes, and if you are developing questionnaires, you would be using think aloud interviews, cognitive interviews. And then in the section on data analysis and management, it's very much important to be, again, informed and aligned with your research question, but also be pragmatic. What is your time and what are your resources available? Define and justify your chosen analytical method. Describe how data is managed and describe the process of analysis. So in the example, we have stated analysis and transcription of interviews will start as soon as data collection commences. It's not required with every methodology, so check that, what your methodology requires, asks for. Transcripts will be analyzed using reflexive thematic analysis, provide reference. Analysis will involve familiarization of the data, so the full process is described. And NVivo, so it's a software for managing qualitative data. So NVivo qualitative data management software will facilitate management of the data set. And it's important to notice that the NVivo is being used to help to manage data and not to analyze data, as sometimes we see. And then you also have to provide some reassurances that what you are going to be doing, that there will be quality to that, and how you are going to enable that quality to happen. So, for example, the example says standard methods, so audit trail, and second, independent coding and analysis will be employed to ensure rigor and minimize bias. So, for example, what you may want to decide is that at the stage of data analysis, you will have 2 or 3 people doing the data analysis and discussing it. So this is also important to mention. And again, something interesting, a resource available to you is our quality checklist that are appropriate to use with qualitative research as well. And there is a list of few. So while they are being used for assessing quality when you are publishing a paper, for example, they are very useful to consult early on to see whether your study design includes all the stages and all the processes that are then being asked for when quality appraisal of your paper is being done. So this is an example of a Gantt chart and timeline for a qualitative study. And as I said before, one of the pitfalls is that researchers who are not experienced in qualitative research allocate very little time for data collection and for data analysis. And as you can see in this study, it's 10 months that have been allocated for data analysis. So again, it's worth considering your time, resources needed, how many people are going to be contributing to data analysis to design a realistic timeline. So going back to PPI, because it's so important to get that right and not to confuse it with qualitative research. PPI can contribute to development of your qualitative research. It can help you, your PPI members can help you to develop topics, to inform the interview schedule, identify strategies for recruitment, data collection and dissemination, and during the project then can help you to review, for example, patient-facing materials and develop the final interview schedule. They may also be there for you when you would like to discuss themes that are being developed from the analysis. And this is introducing rigor as well and making sure that it speaks to the needs of the population you are researching. Ethical issues are very important to consider during development of your proposal. And it's not, your proposal is not an ethics application. However, the way you develop your study design will tell us whether you have actually considered ethical issues in your research. So you have to mention about capacity consent and how you are going to be collecting it, and anything specific to your population. With qualitative research, there is always a question of anonymity and confidentiality because of the nature of data we are collecting. Then how that data will be stored and protected, how you will share, especially with the big projects, how data will be shared between the team members, so there is very little to no risks to data. And then if, especially with topics that are more sensitive or difficult, and it happens in our healthcare research very often, what type of mitigating strategies you will have in place to deal with that and support your participants so that there is little to no risks to them. So in our example, we had written informed consent will be obtained before interviews are conducted. All interviews will be anonymized on transcription, and identifiable information will be removed from excerpts included in publication, and all data stored are stored on an encrypted hard drive. And very important is to recognize also if you've got a like with our example, feasibility study, feasibility trial, to include a qualitative researcher, to recognize them as part of the team, and clearly specify their role, commitment, and cost, and state their relevant expertise so that the funder can be convinced that you've got on your team that expertise. Also ensure that there is a cost included for qualitative research assistant. So in our example, we had doctor is experienced in supervising and leading qualitative work, focus on mental health, and has specific expertise in research involving children and young people since the studies are on adolescents. Doctor lead the qualitative work stream and supervise the qualitative research assistant to undertake the interviews and analysis. So we understand the expertise of that person, what they will contribute to your project, but also what role they will have on the project and in relation to other team members. So when do you include role a qualitative research expert throughout your study? Well, throughout, that's the response, and you include them at the very early stages of developing so that they can inform not only the qualitative research, but they can design the qualitative research depending on what you are doing in the bigger trial or bigger quantitative research, then throughout the study setup, then throughout study management, so throughout the data collection and data analysis and study close, and they should be attending, as any other methodologists on the team should be attending all team meetings that is discussing the project. And then within dissemination and impact, so in the example, a paper on the qualitative nested study will be submitted. So it will be a separate paper, publication from qualitative study. It will be presented at conferences. And in that study, the findings from qualitative study will inform the main trial. And you saw that video from YouTube about the study, and this was part of the dissemination that they had, that was both accessible to participants, patients, and other stakeholders that they had on the project. So costings, it's important to consider staff cost and time. I would like to bring to your attention the software, qualitative software that requires paying for. And what's important to mention here is transcription of data. And I'm aware that more and more often we are using the transcription services available to us through for example, Zoom or Teams video video that you can transcribe it that way, but the quality of it has to be checked. And still some researchers, especially if you are doing some type of research when it needs to be very detailed and expertise has to be there for transcribing, like conversation analysis, still the transcription is being done by paid services, and you have to allocate to it depending on the level of transcription at least £1 per minute, but it can go up to 150, if not more, if you are doing very, very detailed transcriptions. So summary sections, I will leave it to a moment for you to read. And so for our final slide, so what to be aware of. Very, very well justified qualitative part to your research. Be coherent, align your qualitative, whatever you are doing, your research questions and objectives with the method of data collection and analysis. Be realistic in terms of timeline, time needed for different research processes. show in the way you design your study that you are aware of ethical issues, include a qualitative expertise into your team, be realistic about impact, and consider all the costs that are required for delivering good quality qualitative research. And consider your PPI throughout your application and provide reassurances that that study will be rigorous.